Majesty Dr. Ahmed Al-Saidi, Minister of Health, received the first dose of Pfizer and BioNTech coronavirus vaccine today. More than 15,000 doses of vaccine have arrived in the country, and a second batch of 28,000 vaccines will arrive in January. Froilon Cruz Diolosa, a 44-year healthcare worker, also became the first expat to receive the coronavirus vaccine. Diolosa, who works for the Ministry of Health, received the first dose of Pfizer-BioNTech vaccine.
Well, firstly, I'm delighted that we launched today the vaccination program against COVID-19 coronavirus. As everybody's been following, this pandemic created a havoc worldwide, created misery. It changed life that we used to have. So all of us been very eager, waiting for something to happen to hopefully start changing the way this pandemic has been behaving. We received the first shipment of vaccine on 24th of December, that's Thursday. Unfortunately, we did not get as many as we wanted. We received 15,600 doses, which will cover about 7,500 individuals. The way the vaccines usually made takes a long time. And I can understand why some people are worried that we might have rushed as a scientific community to make these vaccines. But I want to assure everybody, making this vaccine in a short period of time has never compromised the safety or efficacy of the way these vaccines are made. They went through exactly the same steps. The 3 clinical trials, phase 1, phase 2, phase 3 were conducted exactly the same way. The number of participants in these trials was also high enough to reach the statistical significance that we are looking for. So what I'm trying to say that this vaccine proved to be safe, effective, and unfortunately we cannot get enough of them. What I want to also assure everybody that our target in Oman to vaccinate 60% of the public, Omanis and non-Omanis, and the technical team at the Ministry of Health, they put criteria like any other country who should be the priorities, and it will be published. But what I want also to assure everybody that we will never leave anybody behind. Again, I need to remind everybody, the vaccine arrived, yes, but the virus is still here. The virus is circulating worldwide. The arrival of the vaccine and the launching of the vaccination today doesn't mean we need or we can abandon the healthy lifestyles that we have to follow. Wearing the mask where appropriately must continue. Keeping the physical distance must continue. Hand hygienes must continue. Respiratory etiquette, coughing and sneezing must continue.
Shaking hands should not
Shaking hands, hugging, definite no. Gathering, especially in closed places, definite no. Our numbers in Oman since the middle of October, walillah alhamd, coming down. Both the confirmed cases, the admission numbers, and the ICU. Yesterday we had, alhamdulillah, only 37 cases in the intensive care in the whole country. A couple of months ago we had 220. This would not have happened without the cooperation and adherence of almost everybody to the healthy life, to the healthy behaviors that we've been mentioning and repeating over and over again. The vaccine, this is the first shipment, and then hopefully early next year more shipment will be following, and we'll try to cover the 60% in the country that we promised. We will try to make some of it available also when we can secure enough vaccines in the private sector for those who don't want to follow the priorities that the Ministry of Health has designated. The vaccines also would not have been here without the full support of His Majesty Sultan Haytham, who's been following all what's been happening regarding this pandemic, and he's been very supportive since the beginning. So thanks to His Majesty, thanks to all my colleagues in the healthcare and the media for spreading that news. But the healthcare staff, they've been the heroes of this period, and they are working in difficult conditions, but they proved that they deserve the thank and the trust that we all give them. I cannot thank them enough. And of course, it's not only the Ministry of Health, everybody in healthcare sector, whether private or government, and the supporting agencies as well.
First, I have the honor to take the second dose after His Excellency the Minister of Health, and I congratulate the Sultanate of Oman for this initiative and for the launching of the national campaign against COVID-19. And this is an important step together with the preventive measures like continuous hand hygiene, hand washing, physical distancing, wearing the mask, avoid crowds, all of these plus the vaccine. This will help all of us, communities and government, to get rid of transmission in the community, and at the same time to prevent the Sultanate from COVID-19 and from further transmission. Also, I want to say that until now, there are no studies that say that the vaccine is not working on the new variant, and WHO always through the COVAX facility is watching on all vaccines that already in use now or to be used later, in order to give the full and complete information about the vaccines. The most important, that the principle of vaccination is very important. The Sultanate of Oman has a very strong immunization program, and this what makes WHO satisfied with the impact and with the national plan that was put by the Sultanate in order to vaccinate the communities of Oman and increasing the community immunity and hence reaching towards eradication of this pandemic.
The Ministry of Health has determined the immunization time in Muscat Governorate. A statement issued online by the Ministry of Health officials said the COVID-19 vaccination is reserved for the high-risk group. A team from Ministry of Health will contact them soon. The immunization time at SEEP Specialized Polyclinic and Bosher Specialized Polyclinic are daily from 7:30 a.m. to 8 p.m. and in weekend and public holidays from 9:30 a.m. to 3:30 p.m. Whereas at Kuriyat Polyclinic, the immunization time is from Sunday to Thursday from 7:30 a.m. to 2:30 p.m. according to the statement issued by the Ministry of Health. Now, temples and churches in the Sultanate of Oman have reopened with all measures to limit the spread of COVID-19 in place. The Ministry of Awqaf and Religious Affairs, known as MARA, had allowed the reopening of temples and churches in the country after they had been temporarily shut during the pandemic, with an official listing the precautions required for them to operate. The measures required for them are the same as the ones taken for the opening of mosques, according to the official from the Ministry of Awqaf and Religious Affairs. He continued saying that these include physical spacing, sterilizing hands, wearing masks during their time spent in the church or temple, avoiding shaking hands, avoiding touching surfaces and objects as much as possible, and preventing overcrowding while entering or leaving the premises, and a commitment to stay at home if a person exhibits any relevant symptoms. The decision to allow places of worship to reopen was taken on 13th December. This is providing they follow all the precautionary measures required. A representative of a church in Muscat did confirm what the ministry had said. Only some religious facilities have resumed so far, said Father Shijo, the vicar of St. Mary's Jacobite Syrian Orthodox Church in Muscat, which is located in a complex in Rui that has a number of other churches. In keeping with Ministry of Awqaf and Religious Affairs guidelines, instructions for visitors worshipping at 2 temples in Muscat were also issued ahead of the reopening. Visitors entering the temples will not be allowed to sit or meet or talk with other visitors, temple priests and staff on the premises, said temple management in their advisory. They also added that they should pray and move out of the temple as early as possible. Visitors need to undergo temperature checks during entry. If temperatures are above 37.2 degrees Celsius, they will not be permitted to enter. Wearing masks or face shields is mandatory, and a physical and social distance of 1.5 meters must be maintained at all times. Lastly, they said that do not share your personal protective equipment and no social gatherings are allowed in and around both the temples. Photography and videography on the premises are currently prohibited, and washrooms and toilets will remain closed for the time being. Those who are sick or present symptoms of COVID-19 or have been in contact with someone who has tested positive for the disease must not visit the temple, as well as those who suffer from chronic diseases and the elderly. Some places of worship, while they were closed, continued to hold prayer meetings virtually. Among them was the Protestant church in Oman. It's time for a quick commercial break, but stay tuned as we have more updates coming your way from International Desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to TTV. You're watching Midday Update. Now continuing the stories from our international desk. Global COVID-19 cases surpassed 80 million mark on Saturday, according to the Center for Systems Science and Engineering, known as CSSE at Johns Hopkins University. The global case count reached 80,070,327, with a total of 1,753,839 deaths worldwide as of 12:22 p.m. local time, the CSSE data showed. The United States reported the most cases and deaths around the world, which stood at 18,794,545 and 330,509 respectively. India recorded 10,169,118 cases, ranking second in the world. Brazil followed with India with 7,448,560 cases and the world's second largest death toll at 190,488. Countries with more than 2 million cases also include Russia, France, Britain, Turkey, and Italy, while other countries with over 50,000 deaths include India, Mexico, Italy, Britain, France, Iran, and Russia, according to the CSSE tally. Global cases hit 50 million on November 8, topped 60 million on November 25, and surpassed 70 million on December 11. It took 17 days for the global caseload to jump from 50 million to 60 million, 16 days from 60 million to 70 million, and only 15 days from 70 million to 80 million. The United States remains the worst hit nation, accounting for more than 23% of the global cases. U.S. experts warn there could be a post-holiday surge given the considerable amount of travelers nationwide in the midst of the Christmas season. Now, another 34,693 people in Britain have tested positive for COVID-19, bringing the total number of coronavirus cases in the country to 2,256,005, according to official figures released on Saturday. Another 210 have died within 28 days of a positive test, bringing the total number of coronavirus-related deaths to Britain to 70,405, the data showed. The reporting of cases and deaths has been affected by the Christmas holidays in some devolved regions and will be reported later on, which means the true total number of cases and deaths in Britain is likely to be higher. From Saturday, another 6 million people in England have been placed in the highest tier 4 restrictions, while Scotland and Northern Ireland have also imposed tougher measures on their citizens on Boxing Day. London and many other parts of England have already been under tier 4 restrictions, which require residents in the areas to stay at home with limited exemptions. People are also urged to work from home when they can and should not enter or leave those areas. For those in tiers 1, 2, and 3, up to 3 households were allowed to meet only on the Christmas day, while in tier 4, people should not mix with anyone outside their own household. It's time for a quick commercial break, but stay tuned as we have more updates from our sports desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Midday Update. You're watching us on TTV. Now continuing for the stories from our sports desk. Ahead of their clash against Chelsea, Arsenal manager Mikel Arteta has said that the Blues have the strongest squad in the Premier League. Now Arsenal are hoping to turn around their miserable start to the 2020-2021 season as they host Frank Lampard's side on Boxing Day. Arsenal sits at the 15th place with 14 points in as many games with Chelsea are at the 5th spot with 25 points. Chelsea always have a great squad of great players. The team that we faced a few months ago was a top one. In this moment, you're probably talking about the strongest squad in the Premier League. They are doing a really good job. Frank is doing a really good job. Goal.com quoted Arteta as saying. He also added that he's got a team full of belief and confidence, and even though they had some defeats, they got back to winning, and it's a team that is going to be fighting for the top spot in the league for sure, he added. Now, New Zealand skipper Kane Williamson has equaled the record for the most 50-plus scores for the Kiwis in the longest format of the game. The right-handed batsman achieved the feat during the ongoing first Test match against Pakistan on Saturday. Williamson now jointly holds the record of the most 50-plus score with former New Zealand skipper Stephen Fleming. However, Williamson is still 15 half-centuries away from topping the list for New Zealand. Fleming has 46 half-centuries under his belt, while Williamson has 32. The Kiwi skipper hit his 23rd Test 100 and second in the row on Sunday following his 251 in Hamilton against West Indies. However, spinner Yasir Shah got the better of him in 105th over after Williamson had steadied New Zealand's ship. With the hosts looking in a dismissal position at 13 runs with 2 wickets down, the Kiwi skipper stood up and got counted on day 1. For Pakistan, it was a one-man show on Saturday as Shaheen Shah Afridi picked all the 3 wickets, first dismissing the Kiwi openers and then sending back Taylor. With this news, we have come to the end of the episode for today, but stay tuned as we'll be back again tomorrow at 2 p.m. with a very different format. So stay tuned and keep watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.